If you grew up under one particular system or culture, it is actually very difficult to imagine what life might really be like before it, or is like outside it. It is almost impossible for urban teenagers, for example, to imagine life before the car or the telephone, or before the cell phone for that matter. In the same way, it is hard for citizens of the Western world to get an accurate impression of what life was like before the era of scientific medicine. Yet, however difficult it is to visualize healing in the past eras, if we could go back a century or two, we will see that what we now call conventional medicine was not always the established and conventional school. Furthermore, what we now call alternative medicine was not the alternative to it. In the fairly recent past, the two schools were virtually indistinguishable. Looking at today's conventional doctors, equipped with their white coats, diplomas, and stethoscopes, and comparing them and their appurtenances with the wide range of dress, fashion, thought, speech, and techniques employed by complementary practitioners, it is hard for us now to imagine that the two schools ever had anything in common. But they did. In fact, it's conventional medicine that is the recent upstart, the brash new kid on the block. What we now call conventional medicine has only recently graduated as a scientific or partly scientific discipline, embracing a central corpus of accepted philosophy, rules, and regulations. Before that comparatively recent era, the ancestors of our modern conventional doctors were an ill-assorted group, comprising a few scientists, a few skillful and observant bedside physicians, and a larger collection of hopefuls, fakes, and frauds, all of whom can trace their ancestry back beyond alchemists, herbalists, priests, and nuns to tribal shamans and magicians. Painful though it is for patients and healers to admit, the true origins of healing go back farther than a few centuries of clever clinicians and experimental herbalists. The true prehistory of medicine is magic. The earliest origins of human healing activities predate any form of man-made recorded history, so that most of what follows is necessarily conjecture, a polite word for guesswork. However, healing seems to be mentioned in the very earliest known physical records of mankind's activities, so some form of it must have been in existence by the time men began to evolve symbolic language. In the earliest days of human society, the local wise man was probably the one who had the answers to everything. He, or sometimes she, was the one who had the answers to the birth of the universe, the origins of mankind, the purpose of life, and the remedy for disease. All these activities will almost certainly have been linked by a theory or legend unifying the forces of life, the purposes of the gods and nature, and the place of human beings in the universe. There will have been, presumably, a sense of continuity between mankind and other inhabitants of the planet, and a sense of overall satisfaction with the way the universe operated. When things seem to go wrong, such as storms, predation by vicious animals, or occasional infections, the wise man would offer some explanations and some incantation or specific action to remedy the problem. If the problem was self-limiting, such as a solar eclipse, then the action, such as the South Sea Islanders' custom of banging drums and blowing trumpets to make the moon disgorge the sun, would be seen to be effective and would be repeated each time the problem arose. Precisely what the wise man said, we shall never know. But what the wise man did, we can guess at. He bashed holes in his patients' skulls. Triphining, the technical term for the therapeutic ventilation of a fellow human skull, is offered by archaeologists as evidence of the earliest medical intervention. Skulls as old as 10,000 years have been found with unambiguous evidence that they have been triphined. The Incas of Peru were masters of the art of triphining, but the idea seems to have occurred to many different societies with little likelihood of them learning from each other. If we are looking for evidence of the first doctor-patient relationship, this seems to be what we are seeking. And, like most doctor-patient relationships since, it causes greater pain to the patient than to the doctor. The holes in the skulls are neat and accurate, and there is usually fresh growth of bone around them, suggesting first that someone other than the owner of the skull did the triphining, and the second that the patient survived. So, what was the purpose of the surgery? There are some clues. The holes are usually found near a pre-existing crack in the skull, indicating an attempt to relieve the effect of a fracture. Presumably, the triphiner must have had some special skills, or at least a lack of squeamishness, and his professional qualification would probably have been inferred by potential patients from the survival of a few of his earlier clients. One skull in Sardinia, dating from about 1400 BC, shows that its late owner had had 3 operations before succumbing to a 4th. Here, then, is the first evidence of treatment for a headache, perhaps predating the discovery of aspirin, originally extracted from willow bark, by 5 millennia or more, whether or not the prehistoric healers ever said, "Make 2 holes in his head, and call me in the morning," we shall never know. But at least we are certain that, at the dawn of mankind's social organization, somebody seems to be trying to do something to heal somebody else.